Good afternoon and welcome to Mount Sinai's Epilepsy Center, Voices of Epilepsy Surgery, a webinar. I'm Gina Gehring. I'm one of the epilepsy doctors at Mount Sinai, and I think we're all very excited to be here today. I think it's going to be a wonderful discussion, and I want to just thank all of you for tuning in and hearing these stories about epilepsy and ways we can treat seizures. And so we're really blessed here at Mount Sinai with an amazing team to help us take care of people with epilepsy, and that includes physicians and neurosurgeons, but it also includes our amazingly trained nurses, EEG technicians, neuropsychologists, social workers. We can probably go to the next slide and show more of our team. It also includes our coordinators, our nurse practitioners. We just have an amazing team. But of course, the most important members of our team are our patients and their loved ones. And that's why I think this is going to be a wonderful discussion, because we're going to be hearing from those patients. And we're going to hear how everybody has a different course, and there isn't just one way to manage seizures or treat seizures. We just wanted to also just mention that epilepsy is quite common, and over 1 million people in the United States have seizures, even when on seizure medications. And there is multiple studies showing that many of these patients are going to benefit from epilepsy surgery, but it continues to be very much underutilized. And I think one of the reasons we see that is because there's a real gap in knowledge about epilepsy surgery and an understanding of what it actually is. And so that's why I'm so happy you're going to hear about these stories today. And so let's get on to our main event and hear from Ravi Ghotra, who's going to be speaking with Dr. Lara Marcuse and Dr. Saadi Ghatan.
Welcome, Ravi.
Yes, thank you.
So one of the things I was thinking about this morning as I was getting ready for this is that this work is really about long-term relationships. And I looked up when you and I met, and you and I met in June of 2012.
Wow.
That is a long time ago. So can you tell us a little bit about your epilepsy and what your seizures were like?
Sure thing. So my first seizure was when I was 14 years old. It was at night, and I was in my bedroom, and my parents heard some commotion in the bedroom. And when my parents came in, they saw me face down against the bed, uncontrollably shaking.
Yeah.
So you could imagine how traumatic that experience was, not just for me, but for both my parents. So it was during that time when we decided to reach out for the care of Mount Sinai and you, Dr. Marcuse and Dr. Ghatan. And my epilepsy, I basically had two types of seizures. I would have the full tonic-clonic motor seizures, and that would be once every 3 months. And I would also have something called focal impaired awareness seizures. So my tumor was on my left temporal lobe, and that's in the part of the brain for language and comprehension. So when I would have that seizure, if we're talking right now, I wouldn't understand what you're saying, and I wouldn't be able to speak. So that would happen 2 to 3 times every day.
And you would kind of go like this.
Yeah, I would
like, don't talk
just
to me.
pause life.
Talk to the hand.
Well, we all know that, and you know better than anybody, that living with seizures, especially uncontrolled seizures, can have such a huge impact on virtually every aspect of your life. Tell us about that. How did it affect your daily life, your independence, relationships, school, all these things?
Yeah, so I might have not been aware of it then, but it significantly impacted my life. It impacted my life academically. I was in high school then, and I went on to college, undergrad. And if I was talking to a professor and it would happen, it would just kind of be awkward. I would just walk away. It would affect me in my career-wise if I'm talking to someone. Again, it would just create an awkward atmosphere where I just walk away. And it affected me socially too, with friends, with family. If they don't have the background knowledge of my epilepsy, it would just create like an awkward situation. So it impacted me.
Really stole your independence then.
Yeah, but I would have to say, I feel like children and teenagers, they adjust to the circumstances that is put upon them better than adults.
True.
So I decided that was something I had to live with at the time, and I just persevered and kept living life.
So can you tell us what was the moment that you decided that you would actually go forward with this idea of epilepsy surgery?
Sure. So the moment that I decided to get the surgery was I was an undergrad and I was driving home. So up till this point, every single tonic-clonic seizure would happen nocturnally when I'm sleeping. So this actually happened during the day and while I was driving. So this happened when I was driving, and you would think when someone has a seizure, they have full extension of their limbs. You'd think like I'd slam on the gas pedal or something, but that did not happen. Luckily, thank God, my foot missed the gas pedal, and I've only got to thank, I don't know how, but the car just graciously parked itself on the side. So from that moment onwards, it was a blessing that no one was injured, me or someone else. But from that point onwards, my epilepsy became more serious. I could have injured myself. I could have injured my family if someone was in the vehicle, and I could have injured someone else. So that's when I decided to get the surgery.
Well, it took a lot of courage, and when we think back about your specific surgery, it was pretty unique. Most people who have surgery are asleep and they're under anesthesia, but yours was one that was done awake. How much do you remember about that? What are your reflections on it?
So I remember everything about my surgery years later, but my surgery was unique, like you said, because it was a 4-hour resection, and like you mentioned, I had to be awake because it was in the part of the brain for language. They had to assess me that nothing's happening with my language. So I would continuously talk to a neuropsychologist, and for 4 hours, and it was rough, it was tough, but it was not hard as living normal life with daily seizures. So I was really happy that I got it. And the recovery was surprisingly much more smoother than I thought. The recovery, it was mentioned that I might lose a step in my language or comprehension immediately after my surgery, but that didn't happen at all. I had my language, like I saw your guys' faces as soon as I woke up, and my mom's and my family, and
We
I
were
was
really happy.
I was able to talk from the get-go. It did take me a couple of weeks to get like my mind up to speed, but the recovery was smooth.
Great.
I want to bring the three of us back to a moment. So before your surgery, the three of us had a family meeting with you and your family, and Dr. Ghatan went through this incredibly complex procedure, and then you wanted a moment just to talk to me and Dr. Ghatan without your family. And the thing that you wanted to say surprised me so much, and what you wanted to tell us was that you were going to give back, and that it was so important to you to give to others. This is what you wanted to say to us before you embarked on this unbelievably complicated thing for yourself. And I knew at that time that you were going to be dedicating your life to service. So I guess our last question for you is, what are you doing now, and what's your life like?
So my life now has substantially been impacted by this whole experience. You guys inspired me a lot, specifically the two of you. I was like an undergrad before surgery. I didn't know what I wanted to do in my life, but you guys inspired me so much that I decided to pursue medicine. So currently I'm actually a third-year medical student. So I'm pursuing medicine. I look forward to just positively impacting lives the way that you did to me. That's really all I want to do in my life, all I want to do in my career, is to help people get through going through something similar to mine, but in an easier way. So that's what I'm really up to now.
Thank you.
Thank you so much.
Of course.
So that was really amazing to hear that story. Yeah. I think we have a slide here, too, that just kind of shows. So Ravi underwent resective epilepsy surgery, which is a great option when people have a small area of the brain that can be safely removed. Most people who undergo resective epilepsy surgery are going to be seizure-free, or free at least of disabling seizures after surgery. And so that was a wonderful discussion with Ravi. And now we're going to be moving on to a discussion with Miss Lucy Foote. And she's going to be joined by Dr. Lara Marcuse and Dr. Fedor Panov.
Thank you so much, Lucy. It's so great to have you here. Thanks for having me. I'm happy to be here.
So I think the best way to start is, again, tell us about your epilepsy and how this journey started and what the seizures were like initially.
So my journey started back in 2021, pre the Marcuse days, as I like to define it, as BM. I had a tonic-clonic seizure due to a really nerve-wracking presentation I had to do at work. This was during those pandemic times. We were all working from home, and my brother actually found me in my room, and I was unfortunately in that post-ictal state and had no idea who I was, where I was, what was going on. But thankfully, that was the first and maybe not last tonic-clonic seizure, but it was the first tonic-clonic that helped me define that I did have epilepsy, and I was diagnosed officially in January of 2021. From there, I had about 5 years of engaging with the temporal lobe, right temporal lobe complex partial seizures, and I lived abroad in London for 2 years where I had 2 separate doctors over that course of time. And then was finally welcomed back home and welcomed into the lovely arms of Dr. Lara Marcuse, who has quite frankly saved my life, because I probably wouldn't be here if I hadn't gone through my surgery. And I'm really, really grateful that now, after being diagnosed with refractory epilepsy and sort of having the writing on the wall saying it's about time you get this taken care of, I had a really lovely family support system, an incredible team here at Mount Sinai, and thankfully I'm seizure-free as of 6 months as of today, actually. So that's a little bit of a heightened example of my journey, but it's been a long one, but hopefully we're in the end of it, or at least we're in the good part of the finish line.
So before we talk about like all the surgery stuff, when I met you, you were really having a lot of seizures. And as we worked together and as we changed your medicines, you were really having a lot of seizures. And I would say you were actually, you were a person on the side of under-complaining. I don't know if you know that.
Yes.
So if you can think about what was that like, that period of time where you were having uncontrolled seizures, and what was that like in your life and with your relationships?
So, as mentioned, the BM days before Marcuse, I was definitely not aware of how detrimental this was to my brain. I wasn't asking for help. I wasn't receiving help well. Again, I was having doctors that were not really recognizing the help that I really needed. Every time I'd come for an appointment to say my seizures are continuing, they'd give me more dosage of the Keppra at the time, which was very detrimental to my mental health. And I think for me, my relationships were very grounding. I had someone at the time when I was living in London who was very supportive and helped me, carried me through that process. But I definitely felt as though I needed to be back in New York to find the proper care. And of course, the Mount Sinai community welcomed me with welcome arms. And the second I met you, you were like, "Oh my God, Lucy." You looked me straight dead in the eyes and you were like, "What you've been through is absolutely not okay. And under my care, you will never, ever experience what you went through." And to me, that was the most moving part of my journey, because I actually finally heard from a doctor that I'm on your side. And I think that that's the most important part of this epilepsy journey, is finding those doctors who will care for you, and both of you being the ones that, you know, the precious brain being in your hands. It's, you know, you could birth my babies if you wanted to. It's about finding that care. So I'm really grateful that I have found that.
Yeah, I think meeting you for the first time, I remember the sense of how stoic you were as a human being. And in most times in your life, that is such a great trait. But there was a moment where you needed to be able to ask for help. And I think there's no better person than Lara Marcuse to get you to that as a starting point.
Thank you. I appreciate that. And you've been the best challenger of my perspectives these days. I think you keep me humble in that, you know, this is true, and this is something I need to take ownership of and accept the help that I deserve.
So I think we kind of touched on it, how the seizures were impacting your mental health. But I think there was a lot of anxiety and a lot of depression. Can you just touch on that for a bit?
Absolutely. So the side effects of my medications were really detrimental, I think, as a long-term experience. I think you always see this as in the small print of these medications, but I certainly experienced it over going through Keppra, Lamictal, and now I'm on 2 others, Briviact and Xcopri. And I think over time I was getting very resistant to medicine in general. I was like, stop giving me these meds. They're not working. That was the refractory epilepsy part of me. Maybe the amygdala really did need that small resection, and I did need that hippocampal ablation. But the reality was that I actually started taking Lexapro as of April, right before my surgery this year, and it was monumental for my anxiety. And I think that, unfortunately, the reality with epilepsy is that there is a lot of anxiety that comes with your day-to-day, the unexpected experience of potentially having a seizure in any kind of setting, whether it's on the subway or at work. It can really cause stress in your body, and I didn't know how to manage that. And now, thankfully, I really, really feel like I know my body well. We speak kindly with each other, and the medications that are in my body and that I have to take, they are working, and I believe in them, and I think that's a huge paradigm shift in my experience.
So I think the next big step is, considering a potential procedure to figure out what's going on and to have the whole team potentially be able to help you. So take us through that, because I know it's not an easy decision for anyone. How did you and your family navigate that process?
Yeah, so I think it started with the phone call I received from Dr. Marcuse, which at first call was really hard to hear, but she had received the EEG results from my first ambulatory EEG and was like, I hate to tell you, honey, I think you're going to need surgery. And I didn't want to believe it at first, but the family did come together, and we all came together in your office where you were extremely patient with each and every one of us and our millions of questions that we threw at you. All of them also having anxiety too, because they've been a part of this, and I love them for it. But it was actually the turning point of realizing that I had my doctor who was really on my side saying, this is really your best option, and you being so graceful and careful with the way that you approached speaking to me and my family, that I decided that this was the best route forward. And I do remember after that first meeting, I was like so on this, like, I just can change my lifestyle. And I turned to you and I was like, so what can I do if I didn't do surgery? And you were like, well, you can meditate. And thankfully, now that I've had surgery and meditate daily, full circle, I'm seizure-free. So I guess you have to do both.
So one of the things that we have this picture of you. We actually had to localize your seizures with an inside EEG that we call a stereo EEG. So we're going to show it at some point. But you have electrodes inside your brain and a big turban on. And was it your mother who thought you looked like the Vermeer painting?
Yes, it was.
So your mother poses you like the girl with the pearl earring, and it comes out so beautiful. And you really, I hope everyone looks at the Vermeer painting and then this picture of you. But I thought that there was something so amazing about this person with all of these electrodes in her head looking like a Vermeer painting. I don't know if you want to comment on that. It's a little bit of a side.
No, this is the perfect segue because my mom was the divine intervention of that experience, because she was able to spend the night with me every night that I was doing that very, very difficult but worth it procedure. And she was like, you have to do this. You look exactly like her. And I was like, Mom, no, like, you're not here because of me. Like, come on. Getting in fights because, that happens. And finally, we get the picture and I show you, and you were like, you need to send that to me immediately. And it turned into like a viral sensation of the neurology unit here at Mount Sinai. And so now I'm using that picture in my own personal blog for epilepsy. And I feel like it's a good reminder that even amidst a lot of that ugliness, there can be beauty and there can be humor. And I'm so grateful to my mom, who is always the person who makes us laugh. And she brings the light into this darker condition, and I'm glad we have that picture for the memory books and that you guys all have it now too.
No, that's a treasure. And I think on my end, I remember being on the subway ride back home after meeting you and the family for the first time and getting just a fortuitous text from one of my mentors up in Boston. And he's saying, hey, there's a patient who may need your help. I'm going to send her your way. And right away, reflexively, like, could that potentially be Lucy Foote? And he's like, absolutely. Did you already see her? So sometimes things just line up in life and in the world.
I say it's divine timing that you came into my life, because that is the most crazy interaction. But I'm so grateful to Ron Alterman, who gave us that stamp of approval, because that actually, I should say, is why I was like, okay, I can trust this man. He's not going to mess up with my brain.
So you've been through a lot, right? You went through the first stage, which is a lot of all of us to ask, right? You stayed in the hospital for a little bit, and you are kind of in the bed, and we're waiting for the seizures to happen. You made it through with flying colors for that, and then you had the one-stage ablation afterwards, and you got home. So if you can share a little bit about the experiences of, again, kind of through the surgery and after the surgery.
Yeah. So I always like to say I had 2 surgeries, but Dr. Marcuse will correct me that it was 3. But that first one was definitely very difficult, because you're strapped in to that big turban and you're forced to have a seizure. And with my mom there, she did see another tonic-clonic, because that's the one that you get after after doing such a thing. And it was thankful. I was very thankful that I had that happen within, I think, the first 3 days of being in hospital. But it was a lot of anticipatory nerves. And I actually remember even saying to you once, because I was so worried, like, I'm not going to ever have a seizure again and I'm going to be stuck here forever. I was like, can I have a martini? Because maybe that'll help me have a seizure. And you were like, if it'll help you, you can. But I had so much love and support showing up to that hospital. And to those who are watching who've been a part of that journey, I'm so grateful, because that took a village to go through that experience. And so both the stereo EEG and then the actual resection, they were, and hippocampal ablation, were very difficult because you're stuck in a hospital. But I do think that the stereo EEG is something I look back on, and it's so worth it, not only for the procedural element and where you are able to precisely locate the epileptic activity in your brain, but it's the reason that I can say I'm seizure-free. And I know that it's a really scary procedure for a lot of people, but to everyone I know that asks me about this, I always say, like, it's very much worth the pain and very much worth the price. So I think that if that answers your question, yeah.
No, that's wonderful to hear. And again, as much of an encouragement as we can send out there into the world, how important it is to take that active step for your health.
Yeah.
So now take us through how your life has changed since surgery.
That's my favorite topic. So as of right now, I've cut out a lot of things in my life that weren't deserving of my time, and I think it actually has really helped my brain. One of those is alcohol, and I'm very glad to say that with my 6 months of seizure freedom today, I'm also 6 months alcohol-free, so we'll ride that till the end of time. And then I stopped drinking coffee, because with that anxiety and very heightened emotion, I think that was causing something in my brain, and I'm a huge matcha girl now, and I absolutely love it. And then you also did mention meditation is key, and meditation daily has completely saved my brain. I feel as though that I'm able to rewire my brain through breath and through constant practice of just centering myself, which is sort of the more holistic part of my health, and alternatively to the way that I've sort of seen myself post-surgery. I really wanted to keep that sense of independence that I kept so strongly with my health, where I didn't want epilepsy to define the rest of my life. So a month after our surgery together, I actually took a trip to Europe and went on a yoga retreat. And that too changed my life. I remember panic texting you about it, like, is this okay? Am I safe? And you were like, do what you will. And that's why both of you as doctors have been so incredible to me, because like my parents, you just kind of let me go. You let me figure out my way. And I realized how I can travel on my own and I can live a life with epilepsy and not be afraid. So I think at the end of the day, the life that I have sort of post-surgery is significantly better, and I've left old jobs and started new ones, and I'm so grateful for what the future, I think, has in store for this old brain of mine.
That's so wonderful to hear.
Thank you so much for coming.
Yeah. So if there's a Lucy sitting over there a year ago, what would you tell her?
Oh, good one. So I think that I learned through this process that the brain is not fixed. It's a fluid, capable of transformation experience. And with consistent patience and, of course, with this surgery, I really felt like I was able to rewire my brain. So I would have told that Lucy sitting here, you can do it. You've got this. It's terrifying, but at the end of it, there is so much reward, and with love for your body, you will find seizure freedom. And I honestly feel like I've been able to really, balance out my parasympathetic and sympathetic nervous systems, but that's truly just the baseline, and I know that that's the foundation that I will continue to build upon with my Mount Sinai team and with all these lifestyle changes I've made, because it's only up from here.
That was wonderful.
Thank you so much, Lucy.
Yeah.
Thank you.
I did want to remind people, too, we're getting some questions in the chats, and if you have questions, go ahead and put them in the chat there in the Q&A section. I guess I should say the Q&A section, not the chat. And so Lucy had laser interstitial thermal ablation, which is a good treatment when seizures are coming from a small region of the brain that's well-defined. And most people who undergo LITT, which is what we call it, will be seizure-free after LITT, so that's exciting. But next we're going to be hearing from Alicia Holliday, and she's going to be talking with Dr. Maddie Fields and Dr. Fedor Panov.
So we were just chatting about how we're bringing some age into the room. So also that Alicia has figuring out how long it's been that you've lived with your epilepsy, which is kind of a lifetime.
About 25 years or so. Yeah, it just happened one day at my job, and I worked for the New York State Department of Motor Vehicles, and they told me, they said, you had a seizure. I was like, seizure? What's that? That's not me. But when they took me to the hospital, they said maybe my sugar was low, and that could have caused it. So, yeah, that was the beginning of a whole new lifestyle for me.
But then you lived with it
Yes.
for over 20 years.
Yes.
What can you remember about the seizure that finally brought you to our center?
So, what finally brought me, it was me dealing with different medications and just getting so tired of them changing this and up this and up that. And the Keppra, the Aptimum, so many different names that they tried with me. And I just was like, I can't take it no more. I actually spoke to one of my family members they support me to the fullest, and she reminded me of one episode I had. I said, I think I had an episode, and I went to her house, and I was sitting on her chair, and she told me I fell. I had another seizure, and I had like 2 or 3 of them, and they took me to the emergency room, and she said, you need to find some place that deals with specific epilepsy and not just a neurologist. Just go to one place. So I looked up Mount Sinai, and I made my appointment, and I kept that appointment. Even though I live in Brooklyn and it was in Manhattan, not much of a trained person, but it was time for a change in my life. So that was one. And then I was on a cruise with my daughter, and she saw me have one, and it scared her so much. And So I was like, something has to change at this time. So that's what made me just decide.
Before you had your surgery, what were your seizures like? How did you experience them? And you've kind of mentioned, but how your family experienced them and the differences between them.
So I would never have any aura that I was about to have them. I would wake up in the middle of the night. Things would be changed. I can undress myself or have clothes folded up a different way. Things out of place in my household that would let me know that something went wrong in the middle of the night. Because mostly they would happen at night. Sometimes they did happen in the daytime. But yeah, that's what I would deal with. And it would make me kind of nervous just to what to expect, what to think of, what caused it. I always would think, what is happening? I tried to doctor myself at some times. Once I saw that I wasn't having it, I said, okay, I can go down off the medicine a little bit, but those were not the right steps to take at that time. So. Mm-hmm.
And how did it affect the relationships between you and your family, between you and your job?
So as far as my family members, if they did not know that I was having a seizure, it scared them because I would have such a look, like you could tell I wasn't there, like something was actually going on, but they would not know what it was that was happening. So it would, I would talk to them and let them know that this is what it is and this is what I'm going through. So it was something that I would have to deal with them and talk with them every day. I think as far as my children are concerned, growing up, I don't even know if it happened back then because no one ever diagnosed it as that. So if they seen me, they could have been thinking, well, what's wrong with mom right now, and not even realize that this is what I was actually going through at the time. So it caused a different relationship with my children. Now that once I found out about it and we got a full understanding of what it was that needed to be done or what I was going through, understanding what is a seizure and what triggers it, it was something different to learn and understand about.
So I remember meeting you for the first time, and you were appropriately hesitant about the procedures that we were saying could help. If you can take us through a little bit of that decision-making process with you and the family of actually saying, okay, I'm going to try this to get better.
So it was like what I can remember. I was ready to take the step, but the surgery part of going into my brain, I'm like, wow, that's a really big step to take, And I said, boy, do I really want to do this? And, how much am I sure? But I had my cousin, she's a nurse. My brother is a physician assistant. And they talked to me and they told me that they looked into things that I couldn't understand. They were there to help me to get an understanding of it and to know that it was okay, that it was safe. I had a meeting with family members to let them know the steps that I was about to take so that once, God forbid, if anything would have gone wrong, that they would have known that this is what it was. So that, even before the surgery with medicine, I was hesitant to take that. So that's just was my personality, so. But yeah, once I did it and I made the decision, I felt confident meeting Dr. Fields and the personality that she had, so loving and kind. So she would encourage me that she would have a team that would look at me once I went in the hospital and I had the seizure and they tell me where it was coming from. She encouraged me that, that I would be in the best hands. So that's what made me just say, yes, I would go through with it.
Well, it's wonderful to hear and to have that combination of the team at Sinai to support you, but also to have that team at home. Yes. That's so important to get you through this. Take us a little bit through what you remember about the surgery and the recovery from the surgery.
Okay, so as far as the surgery, since I was asleep, I don't remember too much about it. but I do remember when I actually woke up and hearing like a drilling noise at one time, but then like knowing that they had to actually do surgery to my brain, my head, my skull. So it was something that it's not like a cut on your leg or something that you would just heal from, So it was steps that I told myself that I would have to go through the process of getting through this healing. And it would not be done easily, and I was thankful that I wasn't in a lot of pain. When the pain came, you take your medicine and just help myself to get through it at that time. So I was thankful for that. The device that I have, the deep brain stimulation, it wasn't turned on right away. I think I had to come back in 2 weeks for them to turn it on. So I was anxious about that, to get that process started, to get the dosage lowered for my medicine, and know that now I am seizure free as long as I continue to take the medication and the level that I'm on, I'm doing very well.
That's wonderful to hear.
And can you tell us about some vacations and how your life has changed?
Yes.
In what ways since you've had this surgery?
So actually, right before I had my surgery, I actually had an episode at my job. So it scared my supervisor. And I think that she was like, you just take care of yourself, So me out on medical leave and stuff, they encouraged me. I worked for the state for 25 years. And at 55, I could retire. So I was able to retire with my benefits. And now I get to go where I would like to go. I just came back from Croatia for about a week with my girlfriends. And, yeah, so life is good. And I also explain to them if they see anything, because I don't want anyone to be afraid. I just explained to them that these are steps that I would have to go through, and it'll seem like I'm sleepwalking, but I was good. I'm thankful I went there. I go on cruises, so I do still enjoy my life. I am enjoying it. I'm thankful.
That's so important. We're really happy to have you here and happy to have you back and be able to enjoy life. That's, I think, the goal of the entire team here.
Yes, I thank you. I thank Dr. Fields, Dr. Kushan. I remember him coming in to help out with the surgery from time, just to check on me after the surgery. So I'm thankful for all of you, each and every one of you.
Thank you. That was wonderful to hear.
Thank you.
And Alicia had a deep brain stimulator, as you mentioned, which is a device that's implanted that gives regular pulses to the brain to try to prevent seizures. And it is a good option for people sometimes when we have trouble knowing exactly where the seizures come from. So we can actually use it for multiple kinds of epilepsy. And most people actually aren't seizure-free with it, but over time, over half of people have less seizures with it. So it can be a good option for a lot of people. And thank you for telling us about your experience.
Thank you for having me.
And next, we're going to be hearing from Francesca Chambers. And I think that's going to be a great story to hear as well. And she's going to be with Dr. Maddie Fields, and Dr. Saadi Ghatan is going to be back. And I guess I could mention that she has a responsive nerve stimulator, which is where you have electrodes implanted in the brain that when they detect a seizure, they'll actually stimulate and try to stop the seizure. And that's a good option for people who have seizures coming from two spots or have seizures that are in an area where we don't feel safe for moving it. And with time, after 1 to 3 years, most people will have between 60 to 80% reduction in seizures. So it can be a good option for a lot of people.
And Francesca, we haven't used that name for a while. I've known you for a lot of years, and mainly we go by Frenchie when I refer to you. But tell us about how this whole journey started for you. What was What were the circumstances around that first seizure that you ever had? Tell us about it.
Oh, wow. I was in an incident, a very serious incident, by being stabbed in the back and bumped my head on the steps. And when I went to the hospital for them to remove the knife from my back, I was having seizures.
Unbelievable. And that was on a very important day, too, right?
It wasn't really that important. It became important because I gave birth to my twins with an emergency C-section due to the knife injury.
What an incredible way to get this whole thing started. I can't believe it. And then you went on and started having uncontrolled seizures as time went by. So there was that first one, and as I remember, the way you got to us was because they were out of control. And what kind of an effect did that have on your life?
Oh, wow. It was very bad, to the point where I would wake up on the floor with my face badly bruised, or chewed my tongue in half, a whole bunch of blood. Or one time I almost walked onto the Holland Tunnel from work, not aware of what was going on, until a traffic cop stopped me.
So no question about it, you went from having a life-threatening start to your epilepsy to ongoing life-threatening events every time you would have a big seizure.
Yes.
So obviously you're a tough person. You've been through a lot. You are courageous as the day is long. And we always talk about the fact that considering epilepsy surgery takes a lot of courage. What was it like for you? What led you to even consider it?
I'm going to say Miss Phil's because I just didn't want to do any surgery. I didn't like medications because previous hospitals would just give you all these medications. I felt that I was a lab mice. So, but Miss Phil's, she's just the best neurosurgeon, not even a surgeon, but neurologist ever. And she just talked me into it, and I just was like, you know what, since she's nice, I believe what she say is going to work.
Yeah.
Yes.
Yeah, so you trusted her.
Yes, very much.
She earned your trust. I can't tell you how many times I tell patients, if you're here because Dr. Fields sent you, you got to listen to her. She's the best of the best.
Yes.
I'm so glad. And then when you thought about having the surgery, what were your big fears? What was the thing that you were the most afraid of in going through with this?
That it's not going to work. And plus, again, I don't like staying in the hospital, so I didn't want to stay.
Right.
But
And was there anything that we did when we were talking together? Because I remember those first few meetings that we had, that you were very nervous about it, that it sounded like a really scary undertaking to have electrodes in your head and consider having a device that Dr. Gehring just mentioned that's helping you with your epilepsy.
the conversation, it was good. It's just that in my mind, I just was still saying to myself that this is not going to work. But again, I said, hey, you done took all these medications and they didn't work, so it's about time you try something that most likely, and this is a different hospital, it'll work.
Okay, I'm glad. I'm glad.
Can you tell us a little bit about your experience with the RNS?
Okay. This RNS machine helped me 100% because, like I said, I will have multiple seizures in one day. Now I can say I don't even believe I had a seizure in more than a year now, and that's good. And as long as I take my medication as I'm supposed to, this machine is the best to me. I wouldn't be here if it wasn't for it.
In what sorts of ways has your life changed since your seizures have gotten better?
Okay, well, I'm not embarrassed to be walking out into public transportation alone by myself anymore because I don't have to worry about, just collapsing on the ground And then, as you know, in the city, people don't really help you in the street. They just go for your wallet and stuff. So that helped me. It helped me accomplish a whole bunch of other jobs because I don't have to worry about having a seizure on the job and these people not aware of what's going on, because I would never tell them that I have seizures before I get the job. And then once they find out, then they be like, we don't think this is the right job for you. But since I have this machine, I've accomplished a whole bunch of other jobs.
Fantastic. So it gave you your independence back.
Yes.
Amazing. Amazing. You know, you have always struck me over all these years as being somebody who's fiercely independent. On top of your tremendous courage, on top of your tremendous resilience, your toughness. What would you say to somebody who's out there who has epilepsy, who could benefit from surgery, but still has doubt like you had?
I would say if you're not with Mount Sinai, you should come here. Don't listen to those other doctors and hospitals. But this machine is 100% worth the try. Not even try. You should just do it, because if you have seizures coming from, like they said, multiple sides of your brain, this machine works. And it's not something that's very hard to do or to work with after it's in place, put inside your head on your skull. But this is the best to me that you should get, Ultra.
So I'm just going to echo what Dr. Ghatan said about your strength and your courage, because you go through this journey and you do so mainly by yourself. And I know you know we love you.
Yes.
Okay.
Yes.
Good. And we think about you all the time and use your strength and your courage as an example by which we live by ourselves and by which we hope others will also encompass and embody.
Yeah, you're a huge inspiration.
Yes. Thank you very much. And like
Thank
you do
you.
say, yes, I don't have anyone. I don't live with anyone.
No,
Like,
too tall.
well, yes, I do have my 2 dogs. I have a service dog and emotional support dog. But besides us 4 people, this machine came in handy because it's not safe to have a seizure at home by yourself, because you could be there laying there for days and there's no one there to help you. But thanks to this machine, I don't have to go through that no more. So, yes.
Incredible. Incredible.
Yeah. There's no words.
Can you tell us a little bit about the device and how you have to interact with it? What do you do?
Would you like me to show you? Or?
Sure. You've got props.
Yes. Okay. We start with this tablet, and I call this as a mouse, but it's not. It's a wand. We put it on our head, and we just wait to download the activity that's going on in your brain. And I don't know. Let me see. I don't know. Should I turn it?
Nice.
Yeah.
Okay, so you can watch it as it's downloading. Yeah, I can tell me when it says it's completed.
So it's telling us what happened in your brain that day, right?
Yes. And like part of the machine is on my right side of my brain. Oh, it's no signal. Let's go slow.
You're getting there.
But yes, part of the machine is on my right side of my brain over here where you see me have the wand, and the battery is on the left side of my brain. And it takes a little while. It depends on the internet or the Wi-Fi or whatever.
Which is never good.
And once it's complete, I'll just hit send, and the data automatically goes back to Miss Phil's and Dr. Ghatan computers in their office or wherever, and they can see what's happening in my head for the whole day.
Mm-hmm.
Yes.
And so there have been days where you thought you've had something or you felt something, and you've been able to reach out to us, and we've been able to look it up.
Yes, yes. And if it was something that they seen, they can control from their computers here in the hospital, should they turn the levels up or down on which side of my brain to help me from having a seizure at that time and moment.
Fantastic.
Yes. It's not. But yes, this is...
We give up on
Wi-Fi here.
It's like, because there's no Wi-Fi here, but yes, this is how we do it. And it goes to that, and it just sends to their computer.
Fantastic. Thank you so much for sharing that.
Yes.
So you really already answered this question, what you could share with others who might be considering RNS surgery or other kinds of surgery. What would you leave people with?
For people who don't know about these type of surgeries, or if I come across people in the street, which I have, who passed out in the street and they have seizures and they say that, I have your cards in my pocket all the time. So I would be like, look, y'all need to call here and get some help. But you should at least come and get some tests run on you, so you can just to make sure to find out what type of seizures that you may be having. And if you need these machines in your brain some type of way, don't feel afraid to get it, because it's not going to make the situation any worse. It only can help you. That's how I feel.
It's such an important insight, because what you're telling people is that the epilepsy is so invasive. It's so hard to have to live with epilepsy, and as scary as surgery might sound, Dr. Ghatan reassured you many times that anything that he's proposing isn't a fraction as difficult as that. And yeah, it's tough to go through the procedures, and I've seen some photos of you from the hospital, and I've got some memories about you in the hospital, and I know those are tough times. These procedures were all done with you asleep, but you had to, of course, go through the process, and go through the process mostly alone, like Dr. Fields said. But as Dr. Gearing also talked about, there's a great team there, and everybody is really like-minded and can get you through it.
Yes, and like I said, even though I was by myself, you two was always there whenever, if it was emergency and y'all wasn't in the hospital, I always got them to help me. So, it's, like I said, if it wasn't for y'all, I wouldn't be here.
Thank you. Thank you, sir.
Yes.
Great. So we had some wonderful questions in the chat. I know these were just wonderful. I had a great time hearing all these stories, so I just want to thank you guys. Our first question is a little different, but it's a great question. So a person wanted to know what we can do to help someone having a seizure, even if they're not a medical person, because they were on the subway 3 weeks ago. They saw someone have a seizure that lasted like 20 minutes, and then it took like 20 minutes for EMS to get there. So what would you recommend for helping someone during a seizure?
Sure. So the first thing is to make sure they're safe. So we've had a couple of patients who have actually fallen into the tracks, which is horrifying. But once someone is on the ground, is to place something soft under their head if you can. Nothing should ever go in the mouth. No one has ever swallowed their tongue. If someone puts a finger in there, they have a higher chance of their finger being bit off than someone doing real injury to their tongue. If there are restrictive clothing, you loosen it up. You can, after the shaking part is over, you turn someone on their side. So if there's foam or secretions in the mouth, that they won't aspirate them or won't go down the wrong pipe, that they'll go on to the side, and call 911. Most seizures are 2 minutes. They're self-limited, but when it goes on for greater than 5 minutes, that is a medical emergency. If a seizure is quick, it could be less than 30 seconds, but if someone hits their head, that's a medical emergency. And if someone has seizures that are back-to-back, even if they're brief, but if they don't recover in between, that's a medical emergency. So all 3 instances 911 should be called. Sometimes people will wear a necklace or a bracelet that says they have epilepsy and a number to call on it, but that's not always the case. But keeping them safe as best you can, but it's scary to see when it's scary.
So I'm always upset when I see a seizure, as many seizures as I've seen. It's tough to watch a seizure, but I think the thing is to keep calm, keep the person safe, and stay with them, get help if you need it, So I would say those are some of the big points, Anything else anybody wants to add about seizure first aid, I guess, is what we typically would call this.
Yeah, I think reassurance to the people around there that this is something that is, like Dr. Field said, something that will reset on its own. It'll stop usually, and a person can come to in most of these cases. But it is an emergency, and it does require EMS to get there quickly to provide support. So that as scary as that was, and as long as it seemed, it's just important to support the person and the scene in the way that you do with confidence.
Mm-hmm. And I think also to note that people can be really confused after a seizure and get up and walk away or even be violent sometimes and aggressive. So to keep them safe, but not to restrain them or constrict them, because that's even more disorienting.
People get upset and they can hear it in your voice and they might understand that you're upset, but not understand why. So keeping that voice calm for people with epilepsy, telling them that they had a seizure really helps because they understand why everybody's standing around. So you're okay, you had a seizure. Something like that is usually what I say after a seizure. Just trying to, you don't feel calm, but you got to keep that voice calm.
Right.
Yeah. So we have a lot of other good questions. So one was about kind of how bad does epilepsy have to be to consider surgery? They said, I'm assuming surgery is not for a person experiencing intermittent seizures far apart and pretty much controlled with medication. So when do you talk to your patients about surgery? When would you consider it?
Well, that decision about when to consider it is so individual. For some people, the idea of having any seizures is one seizure too many. And if there is a possibility that a surgery could stop the risk of further seizures down the line, it's important to have a conversation about it. It doesn't mean you have to sign up for it on that day, but it's important to have a conversation about it. And so from my perspective, it's very, very individual. It's up to patients and their loved ones, their support system to just have a conversation and explore the idea, no matter what somebody else has said about whether or not it should be undertaken. I think it's a very individual decision.
Yeah, I agree with that completely. And it does depend on what's happening in the brain. There's some things that we know if somebody has something like a cavernoma, that if that cavernoma can be safely removed, that somebody is likely not to require medication. And it also depends on who the person is. If they're a school bus driver, you might want to be a little more aggressive. And I'm hoping that this webinar gets watched outside of New York City. And I just want to give a shout out to the NAEC, which is an association of epilepsy centers across the country. And they're wonderful epilepsy centers that can do this evaluation. And we're really doing this to close the gap and decrease the fear. And I think as we talk to the people that came in this room to share their stories, you could really feel that we have such strong relationships with them. And I think that's required to get through this process because you really need trust. But there are centers across this country that do this work, and this work is really important. So I want people to really consider it no matter where they're hearing this.
I would agree with all of that. You know, that we have great colleagues everywhere across the nation. I know one question I like to ask patients is what their goal is. You know, that often helps me know, if, they want to be driving around the country to go to car shows. Oh, we really got to get you seizure free, you know. So just knowing what your goal is really helps me determine what kind of options are probably the best for them.
That's a great question to ask, because asking somebody to go through surgery is a big ask. And I always pose the same question to say, if you're going to go through this, I'd like to know what it is what are your dreams? What do you want to do? If you could be seizure free, dream big, and you've got a long and good life ahead of you that could be seizure free. So I think that's a great question to ask any patient who's considering living with seizures or having surgery for seizures.
Yeah. We had another question about why you determine deep brain stimulation versus RNS. Like, what are the decision-making steps in between those two stimulation procedures? And I guess we have a third stimulation procedure we didn't mention, which is VNS, vagus nerve stimulation.
Does the person who wrote that question want to do an epilepsy fellowship for 2 years? That's a great,
I think they
wonderful
were wondering
question.
why we picked deep brain stimulation for one patient and then RNS for another.
You know, I think we
we
try to
picked the
pack
team.
in the Mount Sinai toolbox every single tool that is available. Every single thing, from radiofrequency ablation to vagus nerve stimulation to all of the medicines to meditation to lifestyle changes. And then we meet and we think very deeply and hard about what would be the right decision for each patient. Maybe you can comment, because it was your
Well, don't forget ketogenic diet too.
ketogenic diet. Yes.
Right. That's in there.
Definitely.
But be facile with every tool in the armamentarium. Be able to pick what's right for the individual patient.
Yeah, I think it's a really personalized decision. No two patients are exactly alike. No two seizures between people are exactly alike. And I think we have to be able to go between each of the different tools to know what's best for each person. We have a couple of patients we take care of who have two tools.
Meaning that we might use one kind of stimulation and a resective surgery, or
That's right.
two kinds of stimulation.
Right.
Correct.
Yeah.
Right.
So it's personalized to that patient, and it's this long relationship that sort of takes us through these decisions.
Yeah.
And you heard from two people today, two individuals who have both kinds of devices and have very different relationships with those devices. In Francesca's case, it's a companion. It's somebody who's giving her information at all times and makes her feel safe. It is just such an individual thing, and the way we think about it as practitioners also incorporates those kinds of factors that we know about our individual patients. If they would rather have something that they don't have to interact with and can feel free to go to Croatia and get on vacation and not have to think about it, that's a very important step to take.
Yeah, the lifestyle, and I think most importantly, the seizure type. We use the devices differently. We use them interchangeably as well, with similar seizure types, but it's personalized.
And I think every story we would, if we had another 4 hours of hearing from people, we would hear a different story every time. There'd be a lot of truths that are the same throughout, but every story is going to be different. We had another really good question about what is stereo EEG and how is it different from regular EEG?
Well, in the history of how we had been doing epilepsy surgery, we used to put in big grids of electrodes on the brain surface, and those required pretty big operations. We still do it occasionally when the need is there, but stereo EEG is a supercharged EEG. It's a very effective way of being able to look for areas that are causing seizures or define a seizure network from places that are both superficial in the brain as well as deep inside the brain, and allow us a better understanding than the regular EEG that's out here on the surface of the scalp. So it's a procedure that does require time under anesthesia and the use of a robot that helps us to do basically precise navigation like a GPS system would down to the millimeter to ensure safety. But it gives us amazing information and detail about where seizures are coming from and how they look inside the brain.
We've had quite a few questions asking about like side effects of surgery. What do we normally see, as consequences, I guess, of surgery? And I know it's hard because each surgery is different, and depending on where you operate in the brain, the symptoms can be very different too. But
I would just say that as an epileptologist and not the surgeon, like we, in general, recommend resective surgery when we really think it won't affect somebody. We wouldn't recommend resective surgery if it would cause someone to lose control of their hand or something like that. We would pick a different option. So I think one of the reasons why we had Ravi and Lucy here is those are people, Ravi had resective surgery and Lucy had a laser ablation. And I think they're good examples of people that have undergone something that sounds so scary, and they're completely neurologically beyond intact. And we just wanted to kind of show that, because I think when people hear brain surgery, like when people hear, I'm just going to walk you by Dr. Ghatan's office, he's a brain surgeon, they're like, I don't want a lobotomy. And they get really fearful.
Yeah, you heard it today in the course of the talks with the 4 patients that, of course, fear is a big impediment to bridging this gap and getting patients the treatment that they need. The things that we do in our testing before surgery are meant to protect people from these consequences that everybody fears, such as losing memory or losing cognitive skills, losing language, losing feeling, movement. Changing who I am as a person is something that everybody thinks might happen, but they must remember that epilepsy is doing that to them on a daily basis. It's so invasive and it's harming them daily, and over the course of months and years, that effect is seen, whereas surgery carries very little risk of that because of all of the workup that is done and the choices that are made with these different treatments to keep that from happening. Yes, for the first few weeks after a surgery, you might not feel yourself and you may become down or feel like your life has changed, but you saw for yourself with these 4 people who represent thousands of other patients who have gone through the process that there are better times ahead.
And I wanted to mention, too, we just have a lot of love in the chat for all of our patients and their great stories. So I just want to pass that along, and also for you guys as well. So everybody seems to have really been moved by the stories, and I know I was, too. I think we're kind of coming to the end, so we might have one more question. And I guess one of the questions was, can you stop medications after surgery?
So with Alicia and Francesca, who both have the neuromodulatory devices, as they mentioned, they're both on medications. They are both on lower levels of medications than when they came in to see me pre-surgery. But most of the time, with neuromodulatory devices, DBS, VNS, RNS, people do remain on medications, which is a different story than resective surgery.
So if there's a resection and the seizure focus has truly been removed, I personally would never touch medicines for 6 months, and then we may start to lower medicine. But my main goal in life is not so much whether or not a person takes medicine, but it's how is somebody doing with their life? If they're seizure-free and they don't have side effects from medicine and they're living deeply, and we're a little worried about seizures for some reason, like maybe we knew that there was a little another focus or something, I might leave somebody on a medicine even after a resection. I mean, what I want is to people to be living really fully and deeply, and being free of medicine is sort of like it's a sort of a false tea house, or it's not the most important thing. But sometimes after a resection, we do stop medicine, or after laser ablation.
So again, it's one of those things that's going to be tailored to the patient, their type of epilepsy, and their goals too.
Right.
Yeah. And it's something you have to work with your whole team on. You don't want to make that decision without talking to your doctors. So I think I just want to say thank you. Thank you for hearing these stories, and thank you to everybody who was here today. And hopefully you can pass this message on to other people, and reach out to your providers, reach out to other members of the NAEC, as you were saying, the National Association of Epilepsy Centers, or come and see us. We'd be happy to see you.
And happy birthday, Ravi.
Oh, it's Ravi's birthday.
And thank you for the people with epilepsy who came. You are why we do this work. We really appreciate you showing up tonight, so thank you.
They were amazing.
Yeah.
Thank you.
Thank you.